The URMC leadership team has spent much of the last several years trying to find ways to make it easy for patients to interact with all of their providers. And one of the first things we did was really stand up MyChart messaging to make it simple for you to have an interaction with your doctor, your nurse, a nurse practitioner. And it's worked. We have about 2 million MyChart messages a year that our providers are managing. But what's happened over time is we've made it so easy that we're finding that patients, because they want simple interactions, are now using the MyChart message function sometimes to really talk about new problems, new medical questions, new chronic illness questions, etc. And so what we're going to do is to begin to bill for those questions that really require a lot of a provider's time. If the provider takes more time than to answer a simple message, so 5 minutes or more, and requires follow-up review, may have to look at the medical record, may have to look at the history, the trajectory of the issue that you're talking about, may have to decide whether or not to refer you to a specialist, those are the indicators to the provider that this is a billable visit. When the provider responds to that visit, that response will include a notification to you that that visit is billable to your insurance. Things like a question about a recent lab result, a request for a prescription refill, a behavioral health concern that your doctor is already following, a question about an imaging study that you're trying to schedule. Those are very simple things for a doctor to respond to and will not be billable. We are following in the footsteps of other academic medical centers and independent practices across the country that have gone this route. Less than 3% of total messages are actually billable, and we expect to find exactly the same thing. The individual who decides whether it's a billable message or not is going to be the provider, and really based on a couple of simple criteria. One is if the message response is going to take 5 minutes or more. 5 minutes is a long time, and when you think about it, it means that someone is really giving thought to a question and what that response should look like. The second criteria really is whether or not it requires medical decision making. And the evidence of that would be if a provider has to really go back and look in the medical record, understand what the trajectory has been of your illness. Why are you seeing these new symptoms? Do I have to create a new diagnosis? Do I need to refer you to a specialist? All of that is the kind of medical decision making that goes on in a regular office visit. So more than 5 minutes to answer a question, something that really takes medical decision making, we will bill your insurance for that. If a patient does not have insurance or can't pay the copay, we would treat that in the same way we treat that for any other way that patients get their care. So we have financial assistance available to anyone through the MyChart app or also by calling our billing office. We are using MyChart to be very transparent. You will see a warning message if you start to create a message for your provider via MyChart. That message will tell you that it's possible that your message could be billable.